Hi, I'm Becker. I'm trying to learn medicine. Today, interventional cardiology. And afterward, we're going to do standing yoga. And if you participate in the standing yoga, let's sit down on the screen. Interventional cardiology. Interventional cardiology is a branch of cardiology that deals specifically with a catheter-based treatment of structural heart diseases. Okay, first of all, it is a medicine, so it's partly of medicine, serious medicine. And it is a branch, it is a part of, or a specific area of cardiology, and that is of the heart. So far do I know. And that means interventional cardiology is a specific branch, a specific category of heart medicine. And this interventional cardiology deals specifically with a catheter-based treatment of structural heart diseases. Andreas Grünzig is considered the father of interventional cardiology after the development of angioplasty by interventional radiologist Charles Dotter. Who didn't know Andreas Grünzig or Charles Dotter? Andreas Grünzig is considered the father of interventional cardiology after the development of angioplasty by interventional radiologist Charles Dotter. Let's see first here with a picture on the side. Yes, I did say it. So we're talking about medicine, internal anatomy, and also diseases, especially heart disease. The next thing here, a coronary angiography and angioplasty in acute myocardial infarction. Okay, first the picture, then I read it again. Okay, what is that? That is coronary angiography and angioplasty in acute myocardial infarction. On the left is the right coronary artery, RCA, right coronary artery, closed, on the right, successfully dilated. Okay. That is an angiography, so that type seems to be an angiography. I haven't really got it all out, but that seems to be angiography, that type of imaging. This, to do this picture is called angiography. And I think now the picture itself is angioplasty and not the treatment which is done there. And that whole thing is pictured during acute myocardial infarction, so when the heart had a heart attack, when one part of the heart had an infarction. And it is to see the right coronary artery, the RCA. So maybe we're taking that as the most important part. RCA means right coronary artery. RCA, and that is closed here. And on the right side, it is successfully dilated. So I think that means opened again. Okay, we see here during or shortly after the heart attack, on the left side, I think that one, the RCA, the right coronary artery, closed, and here it is dilated again. And this interventional cardiology is about catheter-based treatment of structural heart diseases. Many procedures can be performed on the heart by catheterization. Okay, there are many things which can be done on the heart with catheters. This most commonly involves the insertion of a sheath into the femoral artery. But in practice, any large peripheral artery or vein, and cannulating the heart under X-ray visualization, most commonly fluoroscopy. Okay, there are many possible procedures which can be done with the heart if there are structural heart diseases. Like closed, what I think it means. Patent means closed, or patents mean open, or whatever. Now, if there are problems with the heart, with all these arteries of the heart, then there can be done catheter work. And these catheters most commonly involve the insertion of a sheath inserted into the femoral artery, bigger in the leg. And in these arteries, there is the sheath coming in, but in practice, any large peripheral artery or vein, but also other large veins can be used for arteries. And cannulating the heart under X-ray visualization, most commonly fluoroscopy. Maybe that thing is a fluoroscopy and the angiography is something else. The radial artery may also be used for cannulation. Here having the right coronary artery, not the radial artery. Can also used for cannulation. This approach offers several advantages, including the accessibility of the artery in most patients, the easy control of bleeding, even in anticoagulant patients, the enhancement of comfort because patients are capable of sitting up and walking immediately following the procedure, and in the absence of clinically significant sequelae in patients with a normal Allen test. Downsides of this approach include spasms of the artery and pain, inability to use larger catheter needed in some procedures, and more radiation exposure. But in recent times, the radial approach is getting popularity due to its patient comfort after procedure. The main advantages of using the interventional cardiology or radiology approach are the avoidance of the scars and pain and long post-operative recovery. Additionally, interventional cardiology procedure of primary angioplasty is now the gold standard of care for an acute myocardial infarction. It involves the extraction of clots from occluded coronary arteries and deployments of stents and balloons through a small hole made in the major artery, which has given its name, pinhole surgery, as opposed to keyhole surgery. Okay. Cardiology, interventional cardiology, is about bringing catheter, balloons, or stents through another artery, the femoral artery, and I think the radial arteries that we are in. And I don't really understand how it should help the heart now. Are they brought from there up to... And interventional cardiology works now to get the heart running again if the arteries have closed by a heart attack, for example, or if there are structural heart diseases that the bloodstream, the blood vessels are too close because of occluded, does it? Oh, yeah. Okay, we will continue for the next part. We're going to read this middle part here very carefully. I just read now, but because I want to. Now, in the next part, we will read it all again carefully. So, if you're here for interventional cardiology or medicine all over, you can go directly to the next video. We will do now the standing yoga. And if you participate in the standing yoga, sit here on this, breathing in and lift the arms up. Doing the easy swings. And breathe out the arms again down. Again, in the arms up. And out the arms down. Again, in the arms down. And out, open the arms to the side. In the arms up. And out, open the arms to the side. Again, in the arms up. Make an space between the toes. And we're doing the hide and seek playing palm tree. Open the arms to the side. Breathe the arms up. And out, we're sinking down into half chair. Again, in and up. And breathe out, open the arms to the side. Breathe again in and lift the arms up. And breathe out, sink again down. And we're breathing in and coming up. We're doing the mark core, close the feet again. And breathe out and open the chest to the sky, down over the arms down. Breathe in, reach up, over across the arms, intertwine the fingers, reach high. And reach in front, hold off the back and breathe out. Breathe in the arms up. Breathe out the arms down, open the chest to the sky. Breathe in, lift the arms up, over across the arms, reach high, breathe in. And breathe out, reach in front, hold off the back. Breathe in the arms again up. And out and down. Make an inch space between the toes. And we're leaning onto our knees. We're doing standing cat and cow. Breathe in. And out. We're making head of the back, the cat. Breathe in into the middle. And out. The belly of the back, the cow. Again, in into the middle. And out. And out. Breathe in into the middle. Out and last time into the cow, the belly of the back. in into the middle. And out with a sharp back up and at the top of backwards shoulder roll. Still the feet 1 inch space apart. Breathe in, lift the arms up. Halfway only. Come up onto tiptoes. And breathe out, lift the arms higher up. Now breathe in, reach high. And out and we're sinking down into the full chair. Still on tiptoes. Breathe in and up again. And out again, down into the chair. And again up. And we're doing the down diving dolphin. Heels down, arms over sides down, close the feet and we're down again. Now we're doing the marmot. Breathe in and bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. And out and stretch the left leg. Breathe in and change. And out and stretch my leg. Breathe in. And out, both legs straight. We're doing the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathing in the arm back in. And out and down. Breathe in, open the left arm up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in the arm again down. And out and down. We're doing the pelican. Make a hand of space between the feet. Shift the weight to the heels. And breathe in and go down. And out and up again. Again in and down. And out and up. Again in and down. And out and up. We're doing the Japanese counterweight. Take hold on the elbows. And gently swing from side to side. Both hands again down, feet together. Breathe in, come halfway up with a straight back into monkey half lift. Out and down again. Again in halfway up. And out and down. Now breathe in the up diving swan, the arms out and up. We're coming up. And the arms down again. We're doing the stretch of Venus. Feet together. We're intertwining the fingers behind the back. Bring them over to one side. We're breathing in, tall up. And out, we're looking over to the side where the hands are. And we're bringing the chin down to the clavicle. Breathe again in. And out, with the arm a bit in and the shoulder down. Breathe again in, lift the gaze. And out, back into the middle. Now the arms to the other side. Breathe again in. Tall up. And out, look over to the hands. Or where the hands are to the side. And bring the chin down to the clavicle. Breathe in. And out, pull the arm a bit in and the shoulder down. Breathe again in, lift the gaze. And out into the middle. We're doing the crab in the morning, breathe in. And out, bring the arms down over chest to the sky. Breathe again in, up with the arms. Out and down. Breathe in, bring the hands together. Out and lean back with the hands together, the thigh, the reed in the wind. Breathe again in into the middle. And again out and back. Breathe in into the middle. And the sky hugger, breathe out the arms long and out up to the sky. Breathe again in the arms up. And out the last time the sky hugger. Breathe in the arms up. And out and down. And we're doing a few eagle's wings. So breathing in, lifting the arms up. And breathe out the arms again down. Again in the arms up. And out the arms down. And the last time the eagle's wings, breathe in, lift the arms up. And out the arms down. Now breathe in and lift the arms up. Bring the hands to touch and lower the hands slowly down to heart center. That was for standing yoga. I thank you very much and until next time.